Let's begin with something many people never realize. Blocked arteries don't begin with a heart attack. They don't even start with chest pain or high blood pressure. They begin quietly, invisibly, and often decades before any symptom appears. The very first step happens inside the delicate lining of your blood vessels, the endothelium. A whisper, not a roar. Now, picture this. Your arteries are not just passive tubes carrying blood. They're living tissue, active and intelligent, lined with cells that respond to your diet, your emotions, your environment. When you're young and healthy, that lining is smooth and elastic. Blood flows freely. Oxygen and nutrients move to your heart, your brain, your muscles. Life flows. As we age, and especially after 60, that inner lining becomes more vulnerable, not because of aging alone, but because of the cumulative impact of choices we often don't think twice about. A diet heavy in processed foods, refined sugars, and unhealthy fats weakens the arterial lining. Years of high blood pressure begin to bruise it from within. Smoking, yes, even a few cigarettes a day, scorches the endothelium like acid. And stress, chronic stress sends out hormonal signals that constrict arteries and increase wear and tear over time. The real danger is that this damage is silent. You don't feel it. There are no alarms going off in your body, but it's happening slowly, day by day, until tiny cracks appear in that inner lining. And that's where the real story begins. Because once that inner wall is damaged, the body tries to protect it. Think of it like a scratch on your skin. Your body sends help, platelets, immune cells, and repair mechanisms. It's the same with your arteries. The body sends white blood cells to the damaged spot. It sends cholesterol too. Not because cholesterol is evil, but because it's a natural patching material. LDL cholesterol in particular tends to lodge itself into those cracks. But here's the twist. Once LDL enters the wall of the artery, it can oxidize. Think of it like rusting metal. The immune system sees this as a threat and responds even more aggressively. It sends macrophages, specialized white blood cells, to engulf the oxidized cholesterol. But these macrophages can't handle the job alone. They die in the process and form a sticky, fatty core. Over time, this mix of dead cells, cholesterol, and inflammation becomes a plaque. And the more damage, the more patchwork the body tries to do. Over years, layer by layer, these plaques grow. They don't necessarily block blood flow at first. They're like potholes in the road. You can still drive, but it's not smooth. The blood can still get through, but the vessel is no longer pristine. It's no longer efficient. And the risk is no longer theoretical. Now I want you to pause and reflect for a moment. None of this happens overnight. It's the cumulative effect of choices made without knowing their consequences. We often think of aging as something that just happens to us, but this process reveals a deeper truth. Much of aging is how our choices shape our internal environment. The body is adaptable, but it remembers everything. Every spike in blood sugar, every cigarette, every stressful night, it all gets recorded in the language of our biology. And the irony is that by the time people start to feel something is wrong, maybe they notice they're winded more easily, or they feel a tightness in their chest, that damage has already been building for 10, 20, even 30 years. That's why prevention is not about panic, it's about awareness. It's about understanding that the first sign of a blocked artery isn't pain, it's silence. And silence, in this case, is not peaceful, it's deceptive. That's why we can't wait until something breaks. We must learn to honor our arteries before they cry out. So what do we do with this knowledge? We become proactive, not reactive. We choose foods that protect our endothelium. Greens, berries, omega-3s. We reduce the load of sugar, salt, and chemicals that corrode us from within. We learn to manage stress, not just push through it, but truly resolve it. And we move, we walk, we breathe, we sleep. We remember that every choice we make today shapes whether our arteries remain open highways or become roads to emergency rooms. In the end, the most dangerous health problems are the ones we can't see until they erupt. But wisdom allows us to see through the surface. It invites us to act not from fear, but from understanding. And understanding is what gives us power. Because when we recognize that the first step toward blocked arteries begins silently, we are no longer blind. We're informed. And once we are informed, we are responsible not just for the life we want to live, but for the quality of that life in every heartbeat we still have. And that, my friends, is the most important rhythm we'll ever protect. Let's move deeper into the story of how blocked arteries form by examining something that often slips under the radar: cholesterol buildup. Now, Cholesterol has been demonized for decades, and while it certainly plays a role, the real story is far more nuanced than cholesterol is bad. In fact, cholesterol is vital for life. Every single cell in your body needs it. It's the backbone of hormones. It helps form your brain, your nerves, your skin. The key issue isn't cholesterol itself, it's what cholesterol does when the environment inside your arteries is damaged, inflamed, and vulnerable. Imagine your bloodstream as a highway. Now picture LDL cholesterol, often labeled the bad type, as delivery trucks. These trucks are not inherently harmful. They're simply trying to bring fat-based nutrients to various tissues. But if there's damage along the road, potholes in the arterial wall, those delivery trucks can crash, break open, and spill their contents. That's when trouble begins. The cholesterol itself isn't the problem. It's how the body reacts to it when it ends up in the wrong place. When LDL particles lodge themselves into damaged areas of the arterial lining, the immune system views them as invaders. This initiates an inflammatory response. White blood cells rush to the site to engulf the LDL and clean up the mess, but in doing so, they create a sticky foam. These foam cells pile up, forming a growing plaque. This plaque doesn't just sit quietly, it disrupts blood flow and can become unstable over time. If it ruptures, it can trigger a clot. And that clot, if it blocks an artery feeding the heart or the brain, can cause a heart attack or a stroke. That's how something as microscopic as cholesterol buildup becomes a life or death issue. But let's step back and ask the more profound question. Why is this buildup happening in the first place? Why are these delivery trucks crashing so often? The answer, more often than not, is chronic inflammation. We talk a lot about inflammation in medicine, joint pain, fevers, swelling, but there's another kind of inflammation, low-grade, systemic, and silent, that is far more dangerous because it doesn't announce itself with symptoms. This kind of inflammation quietly irritates the arterial walls every single day. And what fuels this internal fire? The usual suspects. A poor diet rich in processed carbohydrates and trans fats, lack of physical activity, smoking, and emotional stress. All of these signal the body to stay in a state of constant alert, constantly releasing inflammatory chemicals into the bloodstream. This weakens the endothelium. It makes it easier for cholesterol to get trapped. Over time, this vicious cycle feeds itself. Damage, cholesterol, inflammation, repeat. Here's something we don't often talk about, the psychological aspect of this process. We're not just biochemical machines, we're emotional beings. And emotional stress, particularly when chronic, directly affects our cardiovascular system. When you're in a state of constant worry, grief, or unresolved anger, your body releases cortisol and adrenaline. These hormones increase blood pressure, raise blood sugar, and yes, can even raise cholesterol levels. Your emotional landscape is reflected in your arteries. This is not poetic metaphor. It's physiological fact. It's why people who live under prolonged psychological stress often show faster arterial aging. Their bodies are constantly signaling that they're in danger, even when the threat is just traffic or a tense conversation or financial worry. Over time, this wears the cardiovascular system down. And then cholesterol, which might have been managed efficiently in a calm, well-nourished body, becomes a liability. But the good news, and I want to emphasize this, is that this process is not only preventable, it's reversible. When you begin to calm inflammation, even after years of buildup, your arteries respond. The plaques stabilize. The cholesterol stops accumulating. The body begins to heal. All it needs is the right environment, clean fuel, movement, restful sleep, emotional peace. Even small changes can bring about dramatic shifts in your cardiovascular health. Let's make this personal. Think about your life. What are you feeding your body? What are you feeding your mind? What environments are you putting yourself in every day? Are they healing or harming you? Because your arteries don't just reflect your biology. They reflect your life. Every heartbeat is a record of your choices, your meals, your thoughts, your reactions. We live in a culture that often separates the mind from the body. But in the case of arterial health, that division doesn't exist. The buildup of cholesterol in your arteries isn't just a nutritional issue. It's a reflection of a deeper imbalance. And when you begin to shift that balance, you're not just avoiding a heart attack, you're reclaiming agency over your life. So the next time you hear the word cholesterol, don't hear fear, hear responsibility, hear possibility. Because your body is talking, your arteries are talking. And the question is, are you listening? And when you do listen, when you respond with intention, the healing begins quietly, steadily, and powerfully from within. Now let's talk about the part of the artery blockage that often surprises people, not just the buildup itself, but how it grows. Many assume this happens gradually, predictably, like rust building up on a pipe, but in truth, it's often silent, sudden, and deeply tied to the internal environment of your body, especially how your body handles inflammation and healing over time. As we've already discussed, plaque begins when LDL cholesterol finds its way beneath the damaged inner lining of the artery and your immune system reacts. But what happens after that initial reaction is what truly determines whether a person goes on to develop stable arteries or a ticking time bomb. It's a battle between your body's ability to repair and its tendency to overreact. See, the human body is miraculous at healing. Your arteries are not static tubes. They're living, breathing tissues that adapt constantly. When damage occurs, they try to patch it. The problem arises when this healing process becomes unbalanced. If the body senses danger repeatedly, it doesn't just patch, it reinforces. It hardens the site, lays down calcium, and thickens the artery wall in a desperate attempt to protect itself. That's how soft plaques gradually transform into hard, calcified deposits. But ironically, the more hardened and narrow the artery becomes, the more unstable your circulation becomes. Blood can't flow as freely, oxygen delivery is compromised, your heart has to work harder, and one small rupture, just one, can trigger a clot that seals off the vessel entirely. But there's another more insidious aspect. Not all plaques are visible with standard imaging tests. Some are what we call vulnerable plaques. These are soft, inflamed, and not yet large enough to restrict flow. They're like little landmines, unstable, active, and likely to rupture. And often, these are the ones that cause the most catastrophic events, like sudden heart attacks. The scariest part, they often don't cause symptoms beforehand. No chest pain, no warning signs, just one moment of rupture, one clot, one emergency. So now you may be wondering, what causes this instability? Why do some people live with mild artery narrowing into old age without incident, while others suffer sudden heart attacks with no prior signs? The answer, again, points to inflammation. It's not just the presence of plaque, it's the state of the plaque that matters. Is it quiet and stable, or is it angry, swollen, and on the verge of exploding? Think of it like this. Your arteries are like the soil of a garden. If the soil is healthy, the roots are stable. But if the soil is inflamed and toxic, roots loosen. The surface looks fine until it crumbles. What you eat, how you manage stress, whether you sleep, move, and breathe deeply, all of these affect the quality of that inner soil. A stressed, inflamed body is far more likely to destabilize a plaque than a calm, well-nourished one. This is where psychology enters the equation in a profound way. Chronic stress isn't just an emotional burden, it's a physical trigger. It alters hormones like cortisol and adrenaline, which directly affect your vascular tone, your blood pressure, and your body's inflammatory responses. A person living in a state of unrelenting mental strain is walking through life with arteries under siege, even if their diet is clean or they take medications. It's the total environment of the body that matters, not just one metric. We must start treating our inner environment with the same urgency we give to a clogged drain or a broken bone. Because these plaques are not just passive growths. They are dynamic, they are reactive, and they tell a story about the life you've lived, the burdens you've carried, and the resilience of your biology. But here's the empowering part. Even vulnerable plaques can stabilize. Studies have shown that with the right lifestyle changes, anti-Islamic foods, regular movement, emotional balance, these dangerous soft plaques can become more fibrous, more secure, less likely to rupture. Your body wants to survive. It knows how to repair. What it needs is your cooperation. So if you're in your 60s or 70s and wondering if the damage is done, let me be clear, it's not. Every choice you make from this moment forward can either stir up that inflammation or quiet it down. Every day is a chance to reinforce the walls of your arteries with calm, clean energy. And that includes your mindset, because fear, anxiety, resentment, they're not just feelings, they're fuel for inflammation. Choose instead to live with intention, to eat with awareness, to move with gratitude. Let your arteries reflect not the chaos of your past, but the clarity of your present. Your heart is listening, your blood vessels are listening. The question is, what message are you sending? Now let's bring everything full circle by looking at something many of us take for granted, our daily routines. What we choose to do or not do each day has a direct influence on the health of our arteries. And yet, when it comes to blocked arteries, most people think only about cholesterol, maybe genetics, maybe age. But the truth is, your habits are the final sculptor of your vascular health. These small, repeated choices, especially what you eat, how you move, how you rest, either nurture clean arteries or quietly contribute to their blockage. Let's start with physical movement. Your arteries aren't pipes that simply carry blood passively. They are dynamic, muscular structures that respond to the rhythm of your life. When you move your body, brisk walking, stretching, deep breathing, your blood vessels stretch and relax in response. This flexibility is essential. It keeps the lining of your arteries smooth, encourages the release of nitric oxide, which helps blood flow, and reduces the likelihood of plaque sticking to the walls. But the opposite is also true. Sedentary behavior, hours spent sitting without movement, causes those same vessels to stiffen, inflame, and lose their vitality. And here's the key. This isn't about running marathons or lifting heavy weights in your 70S. It's about consistency, gentle, regular movement, 10-minute walks after meals, yoga in the morning, deep breathing in the afternoon. Restores circulation and reduces the inflammatory signals that encourage plaque formation. It literally teaches your arteries to stay supple, like warming clay instead of letting it dry and crack. But motion alone isn't enough. What we feed our arteries every day matters just as much. We often focus on what not to eat. Avoid saturated fat, avoid sugar. And while that's valid, it's just part of the story. The deeper question is, what foods actively heal the vascular system? Fiber-rich foods like lentils, oats, berries, and leafy greens help lower cholesterol and stabilize blood sugar, both critical for reducing the inflammatory cascade that leads to plaque buildup. Healthy fats, particularly those found in nuts, seeds, olive oil, and fish, help strengthen the endothelial lining of your arteries, making it less likely to rupture or attract damaging lipids. These aren't exotic superfoods. They're everyday foods with profound vascular benefits if you make them part of your routine. Now think about sleep, not just as rest, but as a nightly reset for your arteries. During deep sleep, your blood pressure lowers, your heart rate slows, and your body initiates repair mechanisms that clean up cellular waste and balance hormones. When you miss sleep or sacrifice quality for screen time or stress, you interfere with that repair. Inflammation rises, blood sugar surges, and the lining of your arteries becomes more vulnerable to damage. So sleep is not a luxury, it's medicine. And then there's stress, perhaps the most underappreciated factor. When you are chronically stressed, financially, emotionally, or even subtly through multitasking, your body perceives it as danger. That triggers a flood of cortisol and adrenaline, which over time causes your blood pressure to stay elevated and your arteries to constrict. It's like driving with the brakes on. The system wasn't built to handle that long term. The solution isn't to eliminate stress. That's not realistic, but it is possible to change your relationship to stress. Practices like meditation, gratitude journaling, even daily prayer or quiet reflection have been shown to reduce cortisol levels, improve heart rate variability, and lower inflammatory markers. And that has a direct effect on the stability of your arterial walls. A calm mind supports calm blood vessels. When you step back and look at this whole picture, movement, food, sleep, stress, it becomes clear that heart disease isn't just about cholesterol or age. It's about the environment you create inside your body. Your arteries are not victims of time. They are reflections of how you live. We must stop thinking of blocked arteries as a random fate and start recognizing them as a message, a biological mirror, showing us where we are aligned and where we're not. The good news, this mirror doesn't judge, it just reflects. And it offers you the gift of awareness. Because with awareness comes choice. So here's the invitation. Don't wait for symptoms to change, change before symptoms. Let your habits be the medicine. Let your daily choices become the quiet therapy that nourishes your heart and clears your path. The most powerful intervention is not always a pill or a procedure. It's a decision, one that you repeat quietly and consistently every single day. And the question I leave you with is this. If your arteries could speak, what would they say about the life you're living right now? And more importantly, what do you want them to say tomorrow?